All right, good morning, everyone. My name is Allie Singer-Wright. I am the Program Director for the Virginia Mental Health Access Program. Welcome, everyone, to our 2022 Stakeholder meeting. We're so glad you all could be here today. To start out, I'd like to extend a warm welcome to our Medical Director, Dr. Sandy Chung. Dr. Sandy Chung is the CEO of Trusted Doctors, a pediatric group with over 140 providers in 28 locations in Northern Virginia, DC, and Maryland. She's also the CEO of Health Connect IPA, which is a primary care clinical integrated network of over 250 providers, also in Northern Virginia. With more than 20 years of pediatric experience, she is the founder and medical director for the Virginia Mental Health Access Program, VMAP, which is why we're all here today. She's held over 30 leadership positions in state and national organizations, including her upcoming term as president of the National American Academy of Pediatrics, starting in January 2023. She is an associate professor at Virginia Commonwealth University Health Sciences and an associate professor at Georgetown University School of Medicine. She has 4 amazing children, and her interests include health information technology, health policy, expanding access to pediatric mental health care, practice management, and advocacy for children and pediatricians. Please welcome Dr. Sandy Chung.
Thank you so much, Allie, and really appreciate everyone spending some time on this Friday with us. We're so excited to tell you more about what we're doing at VMAP and what we've been up to this past year, as well as giving you some insight into what we might be thinking about for years to come. So again, thank you so much. We have so many wonderful attendees from all different areas of our state, also in different areas related to child health and mental health, and we appreciate all of you being here and your support. Next slide. So let me start first by level setting and giving us all just what we already know as far as where we are with mental health and our youth. Last October in 2021, the AAP, along with the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association, declared a national emergency in children's mental health and called for an urgent additional investment from really at all levels of government. And then compounding the burgeoning mental health crisis among our nation's youth was the growing demand for mental health services in the face of a shortage of mental health providers in many areas. Families in turmoil everywhere. It made it harder for children to thrive, and they've had to suffer along with everyone else. We know that with the mental health crisis, it's not anything new, but the pandemic certainly made it harder. Families across our country had to deal with the various efforts that we had to do in order to mitigate the spread of the disease. And so that unfortunately resulted in social isolation, parental morbidity and mortality, removal of support systems, and financial strains, which were all known risk factors of poor mental health. The COVID pandemic strained families' abilities to afford basic needs and disrupted access to healthcare, and also appears to have exacerbated the often silent epidemic of domestic violence. And there's more to it too. Unfortunately, we all know with COVID that the impact as far as morbidity and mortality had a disproportionate impact on adults. Many of those adults take care of children. So as of May 1st of 2022, and of course the numbers are higher now, over 200,000 children in our country lost a primary caregiver to COVID, and over 250,000 children lost a primary or secondary caregiver, with Black youth experiencing a disproportionate loss. This means that we have children who are now orphaned or in foster care or losing their mother or father because of COVID. The consequences of this, we have to be careful, right? And so what we see now, let me bring us back to Virginia here. So in Virginia, where are we? You know, we know that 1 in 5 Virginia youth have had a major depressive episode, and 7% of our youth have had a substance use disorder. And sadly, suicide's the second leading cause of death in youth ages 9 to 18 in Virginia. And the Virginia Department of Health and Virginia Foundation for Healthy Youth, they do a survey every 2 years. We didn't have 2021 numbers, but for 2019, we saw that 22% of our middle schoolers and 16% of our high schoolers seriously considered suicide in the past 12 months. This was in 2019. So we can only imagine what it has been over the last couple of years. At that point, nearly 1 in 10 middle schoolers had reported attempting suicide. We've all heard in the press about our emergency room issues with overcrowding and boarding. Certainly with the triple-demic of RSV, flu, and COVID, this has been exacerbated. But we also see here with suicidal thoughts, self-harm, and suicide attempts that emergency rooms have increased, emergency room visits have increased. This started before the pandemic, as you can see here, but it's rapidly increasing. And what's interesting is to look at it by gender as well. While all children are going to the emergency room more because of suicide thoughts or self-harm or attempted suicide, we can see there's a disproportionate impact on girls. We've especially seen this in the face of anxiety and then also an increased prevalence of eating disorders over the last couple of years. So why does this happen? I was talking to a pediatrician who is in the Northern Virginia area, and this person works in the emergency room, and they were so concerned because they couldn't find a bed, for our children that needed to be admitted. And so their waiting rooms were full. The wait time to even be seen in this emergency room, so not to be admitted to the hospital, but just to be seen, was 9 hours long. So if you can imagine the people, I was in the emergency room and saw this, there were just people lining the hallways with their kids and their kids who were sick. And some of the kids had chronic illness, had transplants, had Crohn's disease, had really complex disease that needed to be admitted, but they couldn't be because the beds were full. There were obviously several respiratory issues, but then several of the rooms in the emergency rooms could not be used because there were children with mental health issues waiting for a bed. So why are we here? Virginia actually ranks 48th lowest in this latest report from the State of Mental Health in America. When you look at the prevalence of mental health illness in our youth compared to access to care for our youth. When we think about also how many kids that are having trouble, about 60% of our youth have experienced major depression, and only a third of those who have actually had a major depressive episode, so clinically diagnosed major depressive episode, have been able to receive consistent care. So of the 60% 60% didn't get care, so 40% got care. Of the 40% who got care, only a third of them got consistent care. And one often may think about this as an issue that's affecting those who may be lower income or on Medicaid. But in fact, 17% of our youth who have private insurance in Virginia do not have any coverage for mental emotional difficulties. So, and we talked a little bit about COVID before and how it impacted what happened. And we've surveyed our pediatricians at the Virginia chapter of the American Academy of Pediatrics to see, what were they seeing? What were they seeing on the ground? And 90% of them, and this was in June of 2020, and then we did it again in August of 2021, they saw an increase in mental health conditions in kids. And you can see here on the graph which conditions, not surprisingly, anxiety and depression rise to the top of the list. And then we wondered, was it still a problem? I mean, we knew it was a problem, but we just wanted to check. And then in fall of 2022, so last month actually, we did another survey of our pediatricians, and they voted that addressing the mental health crisis was their top concern. So we have a workforce shortage. That's no surprise to anyone here. We rank 38th lowest in the country for the number of mental health providers, for the number of kids who need care in our community. Next slide. Yeah. So only 4 of our counties have sufficient number of mental health providers, in particular looking at child and adolescent psychiatrists, where there's a national shortage, but certainly Virginia, there's a significant shortage as well. Next slide. Many of you have seen this map before. So this is from the American Child and Adolescent Psychiatry numbers. We have 2 or 3, I'd say, I guess 4 now, 4 counties that have enough child psychiatrists for the number of children in their communities. And then you can see in the yellow, there's a high shortage, and then the orange is a severe shortage. But sadly, when we look at the red counties, there's no child psychiatrist in those counties at all. Next paragraph. I'm sorry, next slide, sorry. So this is a schematic of VMAP in case you haven't seen it. And if you're not familiar with it, there's 2 basic areas where we help this situation. So I'm a general pediatrician, and we were not trained when we went through our residency programs sufficiently to handle this mental health crisis. When I was trained, I was taught to refer a patient if I identified that they had a mental health need. However, what we found over the years is that now when we try to refer a patient, the wait time is 4 to 6 months long in many places. And during that time frame, we have children who are getting sicker and sicker, and families who are suffering because their children are not getting care. So in order to help this, what we do in VMAP is to actually train primary care providers. So anyone who takes care of a child, teenager or young adult, that may be a pediatrician, a family medicine physician, nurse practitioner, or physician assistants. And we teach them how to do this work. How do you screen, diagnose, and then potentially treat a mental health condition if you identify it? Now, once you start doing this work, we're not trained to be psychiatrists, so we need help. And if we have a question, for example, if I had a question about a cardiac issue, I can actually pick up the phone today and call a pediatric cardiologist in nearby or at an academic center, and they'll talk to me on the phone nearly right away, or call me right back. And then they'll tell me what to do and give me advice on how to care for that child. And then maybe they'll see the patient later that day or the next day. However, in the mental health world, that doesn't exist. We don't have a way to do that. Our child psychiatrists, there are too few of them, and they're just super busy, right? They're seeing all those kids who need help. And you can't just stop a child psychiatry visit and step out and answer the phone. So it's really much more challenging in behavioral health to have this. So what we do in VMAP is we actually set up a consult line so that anywhere in our state, a primary care provider seeing a child or adolescent or young adult with a mental health issue can call VMAP, and then a VMAP child psychiatrist will actually call them back within 30 minutes. And sometimes it's not a question where you need a psychiatrist, but rather it's a question where you're wondering what type of therapy a person needs, or what type of accommodations do they need in school, or whether or not we're headed down the right path for a diagnosis. And so speaking to a licensed mental health provider is sometimes the need. And so we also have the line staffed with a pediatric mental health provider who can help, and that may be a psychologist or a licensed social worker. And then once you identify that a child needs care, a pediatrician or family physician or nurse practitioner or PA, we're not therapists, we're not support groups. We may work with people who do that work, but that's not our scope of practice. So we need assistance to help families find care. And so with VMAP, we also set up a care navigation line where we can call, for example, I can call and say, I have an 11-year-old with an eating disorder, and she has Medicaid or Anthem or Cigna or Aetna or United, whatever they may have. And I can call the care navigation line, and the care navigator will actually call the family back and help them find care. Next paragraph. Next slide. I keep saying next paragraph because I've been dictating into my phone a lot. So anyhow, here's another drawing of how VMAP works. So first, we train the primary care providers, and then the primary care provider calls VMAP if they need help with a person in front of them. And then the intake person then directs the call to the resource that they're calling about. Next slide. Just to give you a quick history of VMAP, we started in 2018. We actually started before there was a HRSA grant, and then we were so fortunate to be able to get a HRSA grant with the Department of Health to get VMAP started. And then the General Assembly has been so supportive, and we have been able to get state funds so that we can expand the program statewide and get to the point where we are today. Over the years, we've expanded it so that now we cover all 5 regions of our state. And then now we're currently working on expansion to be more, that the scale and the model really allows us to address multiple populations. And so we're working on early childhood, which we'll talk more about later, and on working some on the emergency room issue as well. Next slide. Here are the 5 hubs, in case you haven't seen our map. We have such wonderful institutional partners across the state. These are places where we have the hubs. So our child psychiatrists, our licensed mental health providers, and our care navigators sit at these various institutions, and they have been fantastic partners, as I've mentioned. Next. And then this wouldn't happen without a team. And so I just wanted to take a moment to thank our executive committee, who represent multiple state agencies, multiple organizations and institutions. We're so grateful. Without them, VMAP wouldn't happen. Next slide. So where are we now? We're so pleased to be able to say we've now trained over 1,000 pediatric providers across our state. If you think about the fact that each provider has a patient panel of anywhere from 1,500 to 2,000 children, that would mean we've reached well over 2,000 children and their families. We've had, almost 4,000 phone calls now to the VMAP line. And every day I hear from pediatricians and nurse practitioners who have used the line and are so grateful because now they can do something when they are taking care of these families. When you've seen these kids grow up since they were newborns, and now you see them struggling as teenagers with anxiety, depression, substance use, all of those things. It's really, really heartwarming for a pediatrician to be able to provide help, because for so long we've felt helpless, and VMAP's really been great about making sure that pediatricians, family physicians, nurse practitioners, and PAs can do this work. Now, it doesn't come without effort. So as you can see here, we've done 22,000 hours of training in order to make this work. Next slide. And I mentioned our funding. We are primarily state funded. We have a few other funds from county and private foundations, and we're so grateful for all of that, as well as the HRSA grant. Next slide. We'd like now to show you a video of some testimonies from some participants. And so why don't we go ahead and do that? I don't think we can hear anything. I don't know if you all can hear anything, but I can't hear anything.
Give us 1 second while we try that again.
While we're waiting, a couple of days ago, I was with a group of pediatricians talking to the White House related to substance use management and prevention. And nearly every single one of the 12 participants that were there mentioned how they use VMAP to manage the child's or the young person's mental health conditions as they were trying to address their substance use disorder.
The VMAP program is essential. There is no way that this should ever be decreased. There are so many children and young adults who need these kinds of services, and there's a need for more specialists in the mental health space. I have reached out through the consult line, and the response, I work after hours often. And so I've called and left messages on the telephone consult line, and I get a call back first thing the next morning. The care navigation system is fabulous, and they reach out to families right away, and the families have been very satisfied. And they then reach back through the practice so that you can track what's going on and keep that in the patient's medical record. You make that phone call and that family is serviced so quickly, where it would take me much longer.
In a lot of my practice, I do mental health care for adults, and I've done some for adolescent for sure. But I've always been like, I have a few more questions. I want to be able to manage that care better. And so I've learned about the VMAP REACH program through the Virginia Academy of Family Physicians, and was excited and reached out. I took the course a month ago. It was a weekend course over 2.5 days. And it was an incredible experience to really dig deep into pediatric mental health in ways that I haven't had an opportunity before in my training, to get connected to VMAP and the resources that are available for us in primary care. Because I do see kids, but I don't see as much volume as a pediatrician does. And so it's really helpful to be able to reach out to a child psych specialist when I have a case that I want to review, because access to that care is so challenging. About a third of my patients are undocumented and Spanish speaking, and half are uninsured of my entire panel. And so, as you can imagine, the access to all healthcare, including especially mental health services, is really difficult for that community. So having this support, having deeper training for my own skills, and then having the backup with VMAP is really powerful for them. It's clear that this is a very, very valuable experience. It's something that me and my independent small practice would not have been able to afford without the support of VMAP funding it and through the funders that are supporting. So I really appreciate that support.
I've called the VMAP line many times. I've called them at least, I would probably say either me or one of my trainees have called the VMAP line probably at least 2 times a week since we learned that it existed. It has been impossible to help families navigate their insurances, and so now it feels like we can do something to help support the family. And so essentially anytime a family is interested in therapy, for the most part, we call VMAP. Yeah, so calling the VMAP line has been a much easier process than what we were doing before. Before it was really entirely on the family hands, and because of the patient population that we see, which is a majority Black young individuals and their family members with like low SES, and they just have a lot of their own psychosocial stressors that are going on. And so now we can really provide support, and by we, I mean calling the line. So VMAP can really provide that support and that follow-up, which has been very helpful. I have multiple, I guess, like quote unquote success stories. And I also think they're successful for a couple of reasons. A, because they've established care with a therapist after attempting multiple times, not knowing how to navigate insurance coverage, and also just like assuming that they didn't have many options because of insurance, because we generally see primarily a vast majority is Medicaid. And so they kind of are just like, well, we probably don't have a therapist that's going to be covered. And so to see a list of multiple programs that you all have found and seeing them become established, but then also because of this like circular process and this follow-up, their success stories, because I know that patients are actually getting into therapy, which I wasn't seeing before.
The amount of mental health issues that primary care pediatricians would be taking care of in the office, but we obviously needed some help as well, because it can oftentimes be just outside of our immediate area of expertise. So then I found out about VMAP, and particularly the VMAP line, which has been, gosh, I mean, an incredible resource for me. I mean, there are few weeks that I go an entire week without calling the line up and finding out placement for a patient or potential placement for a patient. It is amazing. I think it absolutely is a lifesaver. It makes a huge difference in the lives of these children and their families when they have nowhere else to turn, and they have looked under every stone that's out there. So it's really incredible to talk to someone on the VMAP line who can tell me, sure, we'll figure out, something for, this family or for this patient. And then in my inbox just a few days later, I get a curated list of referral opportunities that's been forwarded to a family. And it's just incredible. That works. I mean, VMAP works so well with that. I'm just really, really amazed. I think we'd have fewer problems in healthcare if everything else worked as well as VMAP does. I definitely had just an amazing experience with psychiatric consultation for a teenage patient. And it was absolutely just, I think, the best consultation experience that I've ever had, no matter what the specialty is, no matter what. I think I spent almost an entire hour on the phone with the psychiatrist, going through, every facet of this teenager's care. So it definitely gave me the tools that I needed to really help this family out and to keep them out of crisis so they did not have to go for psychiatric admission at a hospital.
I think there is more buy-in for mental health, knowing that, hey, I talked about the situation, the screening, the tools, and with their permission, I was like, can I share this with the psychiatrist? It makes it easier for you to move forward as opposed to waiting to see a psychiatrist. They've lost valuable time. So I think parents really appreciate the transparency, and they love knowing that I've consulted a specialist in that field, because we are a teaching clinic. And I'm very much involved in medical education. So I'm always telling VMAP, I have the book next to our 3rd year and 4th year medical students. I have family medicine residents rotating to them. I have greatly benefited from VMAP call line, the REACH, the ECHO. I was very comfortable with a short list of diagnoses. But since I took the REACH program, I've definitely grown in my comfort with how to screen for different disorders. How to appropriately ask the question. And then I think with the repetition of all the REACH courses and the Project ECHO discussions we've had, that confidence, and then also feeling confident when calling the VMAP line and talking to the psychiatrist, really giving them a good platform to build on and help me help the patient in turn. And even if after taking the REACH course, if you didn't feel comfortable, you had the VMAP line to confirm, hey, this is what I'm doing, is that okay? I like the QI project option within the Project ECHO. And one of the QI projects that I did was using the PSC 17. That was a screening I had no idea existed before I took REACH. So it was nice to actually learn about it in REACH and then apply it. And then now it's become part of our routine clinic. I think VMAP is probably the best public resource to actively train physicians to provide mental health care. Actually, I do have a patient I need to call about, and I plan to call them today. Because why wouldn't you?
Wonderful. Thank you all. And hopefully that gives you a taste of VMAP and the impact we're having across the state. And it's just so gratifying to see how well it's working. And again, thank you all so much for your support and the continued advocacy efforts to grow the program so that we can continue to help others. So now I'd like to change gears a little bit and we have some very special guests with us today, and we're looking forward to hearing from them. In order to sort of introduce our next commissioner, I am first going to introduce one of our VMAP leaders, and she has been a fantastic supporter and really was there since the beginning of VMAP. I'd like to introduce Bethany Geldmaker. She's the program consultant and grant administrator at the Virginia Department of Health and serves as the HRSA VMAP project director. She supports the delivery of child health services agency-wide by delivering policies, procedures, and performing research, providing technical guidance, coordinating resources, and establishing liaisons in support of service delivery and assessing the impact of new policies, procedures, regulations throughout our state. She is the current chair of the VDH Institutional Review Board and has held a variety of administrative, teaching, and research positions. So her bio goes on much longer, but I think I'll stop there. Bethany, why don't you go ahead?
Great. Thank you so much, Sandy, and good morning, everyone. Interestingly, back in 2018, Sandy from the Virginia chapter of the American Academy of Pediatrics approached our child health team at the Department of Health about partnering on a HRSA pediatric mental health care access grant. We had no hesitation in terms of applying. While a partnership with the Department of Health may seem a bit unusual, our child health programs in the local health districts were experiencing an unprecedented rise in issues of mental health and substance use. Results from our district community needs assessments identified issues of access, capacity, and long wait times for mental health providers, which really increased for us the urgency of trying to address the problem. We have been able to assist with building the basic VMAP framework and support, which has enabled the influx of additional state and private money to expand the program across the state. For example, this year we were successful in receiving an additional influx of federal funding through an expansion grant, which is going to be exploring the educational needs of emergency department staff who are working with the children with mental health needs being temporarily housed in pediatric emergency rooms. So that's just one example of ways that we've been able to be successful with our partnership. We do look forward to continuing this partnership with Behavioral Health, the Medical Society, and the Virginia chapter of the American Academy of Pediatrics. And now to discuss additional efforts of VDH in working with communities around prevention of mental health and substance use issues is our State Health Commissioner, Dr. Colin Green. And I'm pleased to introduce him. He was assigned as the State Health Commissioner back in April 6, 2022. So he's recent in terms of stepping into his position. However, he comes with a really impressive bio. He's a family doctor who spent his time on Eastern Long Island and Central Florida, graduated from Johns Hopkins and Temple University, and is trained in family medicine. He then served 30 years in the U.S. Army with assignments as a family medicine, and that includes delivering babies. So he's got a good prenatal background for us. Family medicine residency faculty, primary care director, chief medical officer of hospitals in North Carolina and Iraq, director of Premier Biomedical Research Institute at the Department of Defense at the Walter Reed Army Institute of Research. And then in 2006, he earned an MPH from University of Washington. Of interest, he has actually visited 34 countries, has set foot on every continent save the Antarctica. But he's been with the health department since 2017, initially serving as the director of the Lord Fairfax Health District. And it's with pleasure that I turn the mic over to Dr. Green. Thank you.
And thank you very much for that introduction. So I was listening to Dr. Chung's comments and then watching the videos, and as a family doctor, they all struck very close to home. And over the years, when I was seeing patients on a regular basis on active duty, I would have loved to have had a VMAP type service. Although in family medicine, we are taught to embrace primary care of all types, including mental health, I will say that I was always much more comfortable handling anxiety and depression in adults than in children. And again, apparently that's not limited to family doctors from what Dr. Chung has said. So what an amazing service to be able to reach a consultant on the spot, essentially. And then once you're aware the service is available, to go back and sign up for a specific training so that you can be prepared for later experiences when additional children come in need. So if I can back up for a second, the Virginia Department of Health, our mission is very broad. Our mission is to protect the health and promote the well-being of all people in Virginia, and that includes all children in Virginia. And we certainly recognize mental health as a key part of that mission. And although Department of Behavioral Health and Rehabilitation or Developmental Services has the primary lead for that mission, it's very much part of VDH, and we happily work in partnership with them. This includes children's mental health. And I won't go back over the stats in detail that Dr. Chung presented so well, but suffice it to say that over the past 20 to 25 years, there has been a substantial increase in mental health disorders in general, and most notably in children, particularly anxiety, depression, and worst of all, suicides. Suicides in general since the turn of the century are up by roughly 76%, and that has occurred in adults. It has occurred in children as well. With that as a baseline, Virginia then faced an unprecedented health and economic crisis amidst the COVID-19 pandemic. So not only was there widespread sickness and the closure of schools and churches and many businesses and people's livelihoods, but there was also the overreaching fear that there was a deadly disease out there that we didn't quite understand and really couldn't predict. That had totally changed our lives. The pandemic certainly had an outsized impact on low-income families and communities of color. Some of the most significant negative outcomes, particularly death rates, were seen in African American communities, Native American communities, and anybody that was rural, regardless of your race or ethnic background. These cities or the localities in Virginia with the highest COVID death rates per capita were Galax, Martinsville, and Emporia. And if you know those areas, that's quite a diversity of ethnic background in the population. But what they have in common is they're poor and they're rural. So those areas of the state were affected, and those groups were affected much more than anyone else. And in that picture, again, children's daily routines were upset. Their learning and their social experiences were removed. And many of us considered at the time, and unfortunately it seems to have come true, that some of the ongoing issues such as domestic abuse, which might otherwise have been picked up if the child had been in school, perhaps went uncovered and undiscovered. So Dr. Chung mentioned about 1 in 5 children in the US are affected by mental health disorders. The incidence of depression and anxiety as well as suicide is growing and is now one of the leading causes of death, particularly in children 10 and older. Fortunately, we've seen recently the appearance of the 988 suicide hotline. And while that's probably better suited to an adult or an older child, it can be used in any situation. The other sort of 21st century equivalent of that is the text line, the 741-741 text line, which may well appeal to those of younger ages, and immediate help can be obtained from either of those. Surveillance and prevalence is the key. And again, the shortage of mental health workers is nothing new. We dealt with it all the time in the Army during most of my career. And it wasn't just limited to the active duty population. The communities that we lived in the States also had shortages of mental health workers, and especially pediatric mental health workers. So again, the opportunity as a primary care physician to be able to make a phone call and reach an experienced specialist is just a wonderful boon. Primary care must be on the front line. We can't step aside. There are just not enough behavioral health and mental health professionals to do this for us. And again, the VMAP program is clearly well suited to make that possible. As mentioned, VMAP began in 2018. VDH can take credit for having obtained and directed the funds, but the remainder of the process, I think, certainly as much, if not more, the credit rests with our partners, DVHDS, Virginia Academy of Pediatrics, Medical Society of Virginia. And I'm sitting here wondering why the Virginia Academy of Family Physicians isn't on the list. Maybe I ought to chat with them. So VDH does have other programs that are in partnership with these and are available concurrently. We do quite a few home visit programs through the Maternal, Infant, and Early Childhood Home Visiting Program, baby care, something called Resource Mothers and Healthy Start. And most of these involve either a public health nurse or a community health worker that makes a connection with, ideally with the mother while she's still pregnant, and continues that connection as the child is born and goes through infancy and childhood. We also, as a public health organization, recognize the impact of the social determinants of health on all health outcomes, and particularly child health outcomes. And there's not nearly enough time to discuss those in the sort of detail I might like to, but there is a program that I would mention. It's called Bridge to Resources, and it's Bridge *2 Resources. That is a quick link for just about anybody in Virginia to find a wide assortment of social resources, so including housing, food, work, and it goes on and on. Now, all you have to do is come to the page, you type in your zip code, and then select the category where you need help, and it gives you a list of organizations to contact. Coming along and well underway now also is the Unite Virginia program, which is an online organization that helps link healthcare with all the social care organizations. And rather than sending the patient to a website, this is more of a referral service, and it actually takes place. And then VDH encourages community members to seek help through suicide prevention communication campaign. And again, the 988 number, the 741-741 text is available. But for prevention, the RTA, the Recognize, Talk, Act program, again, this is for the general public, to not be afraid. First of all, to be aware of the signs that someone may be considering suicide or at risk for it, to not be afraid to talk about it, not be afraid to ask. And then if the person does seem to be at risk, to take action and get them help. So Recognize, Talk, and Act. Since this program is launched, it's had 5 million social media hits, and 18,000 television communication ads have been distributed statewide. So VDH appreciates the opportunity, and I in particular appreciate the opportunity to be at this meeting, to work in collaboration with our partners to address children's mental health in general, their social, their emotional health as well. I would say their spiritual health as well, and all of their needs through each of these efforts. And we're particularly grateful for the VMAP program, and I remain in awe of it as a family doctor, and we look forward to supporting it in the future. So with that, I'll say thank you very much, and I believe pass the mic to DBHTA.
Yes, and actually, I wanted to first thank you, Commissioner Green, for being here and for saying those few words. And just wanted to add that the Virginia American Academy of Family Practice certainly, or physicians, have been a great partner as well. The best part about VMAP is that we continue to grow and expand and continue to look for opportunities to continue to work with bigger groups like that, where we can reach more and more providers and teach them so that we can continue to help serve the children in our Commonwealth.
Well, if I help any way from the family practice side, I'll be glad to, as well as.
Oh, wonderful. Well, I'm going to take you right up on that. So thank you again so much. Appreciate your time this morning. So now we'll turn to the Virginia Department of Behavioral Services, Behavioral Health and Developmental Services, my apologies. To make the introductions, I'd like to start first with introducing our VMAP lead, and her name is Nina Marino. She's a wonderful leader within the state agencies and also within VMAP, and has been really very formative as far as how we've been able to grow VMAP and continue to expand our services. So Nina Marino is the director of the Office of Child and Family Services at the Department of Behavioral Health and Developmental Services. During her time at DBHDS, she's led initiatives including expanding school-based mental health through public-private partnerships, mobile crisis workforce development, expanding youth-focused evidence-based practices, and developing the infrastructure to create VMAP through funding and contract administration. She comes to DBHDS with extensive experience in both mental health and child welfare settings, with expertise in the areas of trauma-informed care, program development and implementation, and best practices in adoption and foster care. And again, her bio is also very long, but I will go ahead and stop there. And please welcome Nina.
Thank you, Dr. Chung. I just wanted to say it's probably never a good idea to go off script, but I'm going to go off script for just a quick moment because the testimonial videos was just such a powerful way to show how important this program is. And as somebody who works in state government, I will just say we don't often get to see the impacts of the work we do. And we are often working behind the scenes, doing the very unglamorous work around contracting and funding and kind of making sure that everything works. But without these sorts of public-private partnerships, it is really hard to kind of move the needle. And I think VMAP is just such a great example of how government and private entities can work together to really solve some big problems and for our children around behavioral health. So it's always a joy and a pleasure for me to come to the stakeholder meetings. I think this is the 4th one that we've done. So each year it is growing and expanding, and I just feel so grateful to have been a part of this project and this initiative from its very early inception. So it's just a real honor to be able to be here, but also just to see how the program is making an impact for kids. So that's my off script part. I wanted to just, again, introduce myself. I'm the director of the Office of Child and Family Services here at DBHDS. And our office oversees the state funding and then the contract with Medical Society, who then administers the program and does, really gets in there and kind of does all the day-to-day work that you all see and feel. So I wanted to just share a couple of highlights from our office. So of course, we've kind of mentioned this already, but we were very fortunate in VMAP to receive new funding this July, around $1.4 million, which was able to help us, or is able to help us expand into early childhood mental health in the 0 to 5 population. This is really important because we know that the earlier we can intervene in children's lives, the more we can have positive impacts. So I think the state is really showing a dedication to that earlier intervention in the 0 to 5 population, which we need to be giving more attention to right now. We've also been able to enhance training in Virginia for providers through VMAP with some one-time dollars. That's included special education law and advocacy training, motivational interviewing, ethics training, and then primary care behavioral health integration. We're also really excited that VMAP has become one of the highlights of not only our agency, but also Health and Human Resources in the governor's administration. VMAP has made it into our strategic plan, which I think you'll be hearing a little bit more about from Commissioner Smith in a couple moments. But really the administration and DBHDS are focused on early intervention, prevention, and youth behavioral health care services. And so VMAP is actually one of our strategic goals in terms of increasing the number of providers registered to be part of VMAP by 10% by next December. So I think we can meet that. I think we can exceed that. We're just really excited that we have that as kind of a highlight for our agency. So in addition to VMAP, our office does a host of other things around children's behavioral health. I don't have time to go into all of those today, but I did want to just talk about a couple of things that I think pair nicely with VMAP. And when we think about how we want to respond to the behavioral health crisis for children and kind of what we need to be focused on as we have come out of the pandemic. So the first one is talking about our screening, brief intervention, referral to treatment initiative. This is a SAMHSA grant we have. It's also called SBIRT for short. It's an evidence-based program that really focuses on screening young people for substance use and also co-occurring disorders. We know those typically are kind of working hand in hand, unfortunately. But it is early intervention and being able to provide psychoeducation, but also brief referral to treatment. And we've been able to partner with trusted doctors on rolling this out, which is really exciting because it pairs very nicely with VMAP. It just has a slightly different focus in just making sure we're screening for substance use. So we partnered with the University of Baltimore and trusted doctors. To date, we have screened over 3,200 youth, and close to 200 youth have been referred for specialized treatment. And we now have 4 full-time clinicians. This is just up in the Northern Virginia area, embedded in primary care settings for this brief treatment and care coordination. We'll be launching a similar model in the Tidewater area next year around pediatric EDs. That's another place where we could really enhance our screening, and then trying to move into more rural practice settings as well. And in fact, we've done such a good job with this. SAMHSA is actually looking at us in terms of providing technical assistance to other states on how to implement SBIRT with adolescents. We've also identified that we really need to be looking at school-based mental health integration and making sure we're catching kids there. As we know, we hear a very similar thing from our school systems and school personnel about really needing to prioritize mental health. So we have partnered with the community services boards, our public mental health system, with some federal one-time funding that we've been fortunate to receive. So we've partnered with 15 CSBs, and they've been able to enhance case management, crisis intervention, and outpatient services directly in schools. And then this past June, we were fortunate to receive the first ever investment by the General Assembly to DBHDS, targeted specifically to build capacity within school systems for behavioral health care. So we received a $2.5 million investment from the state to pilot mental health integration in schools. And so we're partnered directly with schools on this, who will then be contracting with both public and private providers. So currently we're working with 6 school districts, and supporting 22 school districts in over 33 schools. So with that, I'm going to kind of shift into our next speaker. I'm very pleased to introduce Commissioner Smith of DBHDS. He was appointed by Governor Glenn Youngkin as Commissioner of Virginia's Department of Behavioral Health and Developmental Services in December of 2021. Mr. Smith comes to the Youngkin administration with a wide variety of experience. He brings in his new role leadership as a CEO at several hospitals, as a U.S. Army Special Forces Combat Dive Team leader, and most recently his experience overseeing Tucker Pavilion at Chippenham Hospital. Mr. Smith has a passion for team building and a proven track record of employee engagement and empowerment. Nelson is a highly trained and skilled servant, team builder, and leader that is grounded by his faith, family, and love of country. Before working in the private sector, Nelson was part of the U.S. Army 5th Special Forces Group, where he received numerous awards and accolades for his outstanding leadership and courage. His awards include the Purple Heart, 4 Bronze Star medals, 1 including the V Device for Valor, and the Green Beret. Following his retirement as a Special Forces soldier, Green Beret, he received an MBA from Kellogg School of Management at Northwestern University and began a second career in behavioral health care administration. He's committed to ensuring the most vulnerable and overlooked populations in our society receive the highest quality of care. That I'll turn it over to Commissioner Smith.
All right, thank you, Nina. Need to update that. I don't, it's weird hearing things about yourself, so we need to change who wrote it. At any rate, no, I'm very, very thankful to be here. And I hope many of you know, or at least have heard, that I'm absolutely in love with this program. You know, during my 11 months here as commissioner, I've had the opportunity to travel throughout the state of Virginia and hear from many of you. And I'm just so thankful for the partnerships. As a matter of fact, this program is one example of true synergies and collaboration. I keep saying we need a lot more of this, right? This is an example of breaking down silos, as I think I saw Dr. Hazel on here, the silos of excellence. This is a really good example of that. And using what we have. You know, we often focus on what we don't have, and we need more of X and Y and Z. This is focusing on what we have and embracing it and giving it the things that it needs to make it more successful. And so I really appreciate that. I appreciate all the efforts. Specifically, I'd like to thank Dr. Chung and our own Nina Marino for their leadership and everything that they've done to guide this through some very difficult times. When we talk about children's health, mental health related to the pandemic as we're coming out of that, I believe the Washington Post covered this last week. Actually, it was labeled the Nationally Adolescent Depression Anxiety. It was already at a crisis before the pandemic, and it has surged during the isolation, disruption, hardships of COVID-19. Obviously, I've heard a lot of anecdotes around the state, but we're actually seeing this in all the data that's rolling out now. As a matter of fact, last October, the American Academy of Pediatrics and other national groups actually declared a national emergency in youth mental health because of the pandemic. The results of the chief medical examiner, when we're talking about not just mental health, but substance abuse, showed that 2021 was the worst year on record for fatal overdoses in Virginia. And 2020 was the worst previous year. So we're trending in the wrong direction. But what is clear is that in spite or despite of all these challenges in our system, behavioral health services are going to be required even more. I think it's the basis of everything that we need to be doing as Virginians, and be ready to answer this call. And I can tell you, I believe that VMAP is the heart of all of those things. We need to make sure that more children have access to the providers who are better able to screen, diagnose, and manage, as mentioned in the videos, manage a lot of these symptoms, to prevent inpatient care, to keep them in their communities, to keep them with their families, to help them understand how to access behavioral health care in general. I always say that it's one of the hardest things to do is to actually enter into the system, the behavioral health care system. Most people only know it through the emergency room. But yet most people have pediatricians or primary care physicians, or, people get screened for physicals, annual physicals for sports. This is the example. To me, this is the future. So I'll just share some of the updates on what we've been working on here in Virginia. As you know, or if you don't know, I'm going to say it now. Governor Youngkin and the administration is committed to transforming the mental health system. I can tell you personally that this is a governor who's open to changing the narrative, changing business as usual, challenging us to be better for our citizens, for Virginians, to make the Commonwealth the best place to live, work, and raise a family. Now, behind all of that sounds like, nice words, but I promise you there are actions. And that's what we're here to do, is to deliver on that. And show and demonstrate to our citizens that we're actually coming through on what we're saying. So he wanted to hear big ideas. He wants to see better outcomes for Virginians. And mental health is a major priority. It's going to take a lot of stakeholders to develop this larger framework and have really meaningful strategies. But I'm absolutely confident that, using this example is something that we can build off of. And stay tuned. We're going to hear some really some news as the governor announces his budget next week to the General Assembly. And hopefully we'll all have a better context of where we're headed. And then we can buckle down and get to work. We all know these issues are very urgent. As I say, urgency in action. We want to make sure we have a lot of inefficiencies in our system. And in those inefficiencies cause negative outcomes. At any rate, so as Nina alluded to the fact that we have a North Star, when I took the seat, we didn't have in January, we didn't have a strategic plan, or at least one that could be put in front of me. I mean, individual offices were doing the best, doing what they had to do. But how do we synchronize all the offices that we have here in this DBHDS, synchronize those efforts to truly make a huge impact? Number one, if we don't have a strategic plan that we could show to the community, how does the community know where to go itself? So we're without direction, without a North Star, we're reactionary instead of being proactive and leaning into things. So we have a plan. There are 3 big objectives. And I think it's going to really change how we deliver care to our citizens. First is the workforce. Many of you already know. I mean, it's not just healthcare, but I say you probably have had delays in deliveries and your trash being picked up. I mean, it's a phenomenon. It's not unique to this, but in healthcare in general, it's dangerous. So we've got to do a better job at keeping people building a pipeline to develop our Virginians, to put them into the places we need them in healthcare, keeping the people here, our fine institutions, when they graduate. We want them to stay here in Virginia. And then third is to actually bring people to Virginia. We want people to move here and help us to be best in class, the best state in the nation. Again, I believe that we can do that. Workforce. And then the second is increasing our capacity. So we want people to move here. We want them to open up shop here, right? Counseling services, everything that we need here in Virginia, especially places that don't have access, right? So increasing, growing our access, but more importantly, as Nina mentioned, is focusing more on prevention and intervention, keeping people in the community, meeting them where they are, giving them access to the care that they need when they need it. The third thing is modernizing our systems, leveraging our best practices, driving high quality outcomes and measurements. And, you know, we need modern systems. We need to be able to talk to each other, to share that information and not try to recreate the wheel every time you have an interaction with a patient, or if you're a human being, that your records have to chase you around. It's very difficult. So there are lots of things we're going to do to break down those barriers here in the state. So those are really big goals within that. Just to be very clear, there are actions behind that, results, key results that are measurable. So every one of our offices has an action plan that supports that, and they cascade. There's a timeline and a business owner with every one of those. And so I hope in the near future is to share, we're building a dashboard, a digital dashboard that we can show, and it shows graphs and everything else. I like the aesthetics, so I want to make sure it's visually appealing to everyone. But it's a report card. I want to be able to show the community that this is what we're doing, and this is where we are with this. So you can call us out on it, or you can say, good job to the people that are here in government working behind the scenes tirelessly to make sure that that we all have the best in class. Just talk about the state hospitals. We saw a dip in state hospital TDO admissions last year, given the admission closures and the staffing crisis. It's not really surprising. But I can tell you that we've been able to reopen 170 beds due to the staffing shortages. And we're committed to opening all the beds. That's not going to be the answer. I'm sure we can all agree that just opening all the beds is, you know, we had them all open a few years ago, and it was still a bad situation. So, but we have a plan for that. We hope that the reduced amount of TDOs that we've seen year to date, it means that the system is getting healthier. I mean, I really hope so. We're looking into, you know, some of these things. But if the bottom line is, we know that if there's more in the community, options for people to meet their needs where they are, then TDOs won't happen as much. So at any rate, we're continuing to work on that comprehensive care. I already talked about the rebalancing of the system. We want to be less reliant on inpatient care. I think we all can agree inpatient care, we've kind of missed many levels. But of note, this past session, the General Assembly did fund the last phases of STEP Virginia. So the community is currently in the process of building those out. And we're making sure that we're still continuing the good work of Project Bravo. So stay tuned for that. But I'll tell you, fundamentally, like for me, the biggest thing that we're really going to focus on, or have been focusing on, well, everything's important, don't get me wrong, but the crisis system, and it's fragile, as I call it, at best. But I can tell you, we are leading the nation for the work that has been done. 988 is a place that people can call, and someone on the other end of the line can answer and help them. 988 is probably one of the most critical things. It's long overdue. I think we can all kind of agree on that. You know, suicide is the 10th leading cause of death nationwide. Second for people of the ages of 10 to 34. So we rolled out 988 here in the state of Virginia, but nationwide in July. And The reason that we're not going full scale on marketing is we have to make sure it's rolling out like 911 gradually. Because when someone calls, you have to make sure that someone's on the other end. We don't want someone in a crisis on the phone waiting, listening to elevator music. We need a person to answer right away. And then we need, if that person cannot be helped on the line, we have to have the resources to launch a mobile team to their location where they are. And so those things, again, are being built. We have some really good successes in certain areas of the state, but we want that for everyone. Right now, I can tell you our answer rate for 988 is about 91%. I'd say it could be upwards of 96%. We're trying to figure out resolution with the company that runs our lines. The national goal though is 80%. So we're ahead of the curve. We average about 4,000 to 5,000 calls per month. And if you can picture, that is actually 5,000 diversions. That's 5,000 people that are helped in their communities every month. And so the gold standard is 80%, according to the Crisis Now model. 80% of calls resolved on the phone. Here in Virginia, we are able to resolve 93% of those calls on the phone. So you see how that would continue. And then of that remaining 7%, we can launch a mobile crisis team. And then of that, that remainder, it is roughly 65%. May have to get like a crisis stabilization or something like that. So you can see as we build out this system, we can rely less on inpatient and more and return those investments back to the community and investing those resources, again, to keep people where they are. Moving over to substance abuse, we all know there are alarming trends in these overdoses and fentanyl poisoning. As I mentioned earlier with the chief medical examiner, 21 was the worst year for Virginia in overdoses. And 75% of those, I'd say over 75%, were from fentanyl. I mean, that's incredibly scary. So we've jump-started conversations in the regions to help understand what they need to fight at the local level, opioids and stimulants. We've been working throughout the pandemic and now to expand our work around substance use and prevention. We have the SOAR grant, of which we were awarded $52.6 million. And of course, that's going to really strong work right now. But you get a little overwhelmed when you think about all these things, but I can tell you there are so many good things that are going on out in our community. So many people that are passionate, as you are here, that show up every day. They show up in rain, sleet, during the holidays, when we're sleeping, they're out. It's amazing. And I am so, so grateful to be part of this whole thing. I'm grateful to be your partners in this critical time. I feel like we're at a precipice with all the resources headed our way, I hope. Again, we owe it to our citizens. And I am very, very optimistic about what we have on the horizon for us. Thank you for inviting me to speak, and I look forward to your partnerships and a brighter future for everyone that we serve. So thank you. And how are we doing on time? I know I get to introduce a very special guest.
Thank you so much, Commissioner Smith, and please, and thank you for your partnership as always. But yes, please go right ahead and introduce our wonderful next guest.
Well, ladies and gentlemen, I have the honor and pleasure of introducing our next speaker, who very much shares the governor's vision of making Virginia the best state to live, work, and raise a family. As a matter of fact, Suzanne Youngkin joined her husband, Governor Glenn Youngkin, in listening to the concerns of Virginians, and promoting lower costs of living, improving our education for our Virginian children, safer communities, and unity among our citizens. Through her work as president of the Foss Foundation and participation in an array of nonprofit boards, Mrs. Youngkin works alongside leaders and volunteers in many nonprofit areas in the DMV. Among her initiatives as First Lady of Virginia, Mrs. Youngkin spearheads the Spirit of Virginia Awards, which celebrates persons and organizations who are strengthening the spirit of Virginia, recognizing unique qualities and standout achievements across the Commonwealth. She's a mother of 4 young adult children and a founding and active member of the Holy Church, Trinity Church in McLean, Virginia. Please join me in welcoming the First Lady of Virginia, Susanna S. Youngkin.
Thank you, Commissioner Smith. I hope that everyone can hear me all right. Greetings to each of you from the Executive Mansion in Richmond. We're welcoming a host of visitors today to see the holiday decorations and to hear live music and to celebrate in the season. So I'm wishing each of you all a very, very Merry Christmas, Happy Hanukkah, and a special time this month. Thank you for gathering on this most important of issues. I've been learning a lot about what VMAP does and the opportunity it presents for collaboration to really change the lives of Virginians. And I, more than anything, just want to encourage you and thank you. I'm so deeply grateful. I come from a medical family. My father was a dermatologist. My brother-in-law is an orthopedist. As Nelson mentioned, we are the parents of 4 children, 25, 22, 21, and 18. We have been in the trenches over the last 20 years with our youth and now young adults, dealing not only with the pressures that have been influencing their lives, but the strains on their ability to decipher exactly what is normal. I think the pandemic, more than anything, shook all of our realities about what is normal and what is to be expected. There were lives lost, livelihoods damaged. And I really think that more than anything, our young people are suffering. I saw a survey recently that said over a quarter of Virginia's youth, aged 12 to 17, indicate that they have had a depressive episode in the last 12 months. And a depressive episode is not just, oh, I did poorly on that exam, or I don't feel good today. That is something that they feel like was a crisis moment for them. And I think that that's heartbreaking. But I think, again, just like Nelson reiterated, the great news is that people are coming together like never before to step into this void and to come alongside our young people in particular as we navigate what is an unprecedented time in mental health. I will tell you that my team in Richmond has been tirelessly reaching out to women in particular across the Commonwealth to see how we can support mothers and educators and nurses and aunties and grandmothers and sisters as we all work together to figure out ways to assure our family members and our community members that we are there for them, that we love them, that there is a place of connection and a place of community that is relevant in their lives. The Attorney General, Jason Miyares, just 2 weeks ago announced the One Pill Kills initiative. That is an initiative, a federal initiative actually, that is really shining a spotlight on fentanyl and the dangers of fentanyl. I was there in Virginia Beach when he announced that, and we sat with healthcare providers just like each of you, and we listened to them and we heard some of the confounding issues they're facing. The one that stuck with me most poignantly was that many of these substance use disorders that they used to identify in 15, 16, and 17-year-olds, they're now seeing manifested in 10, 11, and 12-year-olds. And that the scaffolding around these young people is just simply not there. So we are so determinedly focused on problem solving around this issue. Commissioner Smith, our Secretary of Health and Human Resources, John Littell, my husband's team, and also my office are pouring our hearts and our heads into problem solving around these issues for Virginians. We are very keenly aware that government does not change lives. Human beings change lives. And so we're counting on each of you to continue to partner with us and to continue to champion the things in your practices and in your communities that you know support those that need it the most. We're here for you. I would love to make a selfish plea that if there are those of you practicing out there that have ideas for us in particular ways to speak to and reach out to women and girls, that you connect with my office. I am running a newsletter every 2 weeks where we highlight a woman in Virginia doing remarkable things. Just this last Thanksgiving, we highlighted a mother who lost her son to fentanyl poisoning, and she was able to tell from a first person, very raw and real place what that felt like and what parents need to know about this most dangerous poison that is out there today and sadly readily available on the market. So again, the idea is to bring these stories to life, bring them to people's screens or homes so that again, they can have the tough conversations that are warranted with those that they love. And if we can make change even in a single Virginian's life, that is what we are aiming to do. So I just am here with greetings. I am here with gratitude. And I hope that this time of togetherness, albeit not in person, but on these screens, gives everyone a slight bit of enthusiasm to step even more into a posture of service to others. I thank you. I wish you the merriest of Christmases, the happiest of holidays, and I promise you that we are here to help. So please be in touch with us. May God bless you, and I so appreciate the time with you today. Thanks so very much.
Thank you, First Lady Youngkin, and thank you so much for your inspiring remarks. We're so grateful that you and the governor are committed to improving mental health care in our state, especially for our youngest and most vulnerable. I had 2 comments for you very quickly just to outline how VMAP is really a scaffolding that can be expanded to help talk about some of the things you addressed. So one is when you referred to working with women, there are other states and there's a model where we can actually expand VMAP to address postpartum depression, postpartum anxiety, prepartum anxiety, prepartum depression, so that our pregnant and new moms are getting care. If you have 4 children and so do I, and we know that we spend a lot of time with our pediatricians, especially in those first few months. And the pediatricians are in a very unique place where they can actually see what's happening to the moms earlier than any other medical specialty sometimes, even the OBGYNs. So VMAP training and VMAP care navigation and VMAP, the consult line, can actually be incredibly helpful in addressing that issue.
That's fantastic. I'm taking copious notes, if you notice why I'm writing down. No, that's so critically important. I cannot thank you enough. It's been interesting in my Strengthen the Spirit of Women and Girls initiative. I have felt a little remiss because as the mother of 3 boys, and as the wife of a big boy, I certainly understand that this is not limited to women and girls. And yet I do feel like in my heart of hearts that mothers and aunties and grandmothers tend to be on the front lines. And they are the ones disproportionately taking children to engage with the pediatricians, and so frequently putting their needs secondary to those that they care for, they love, elder care, and those that are younger. And so again, I love this concept of working with you to make sure that we take care of the caretakers and that we pay special attention to the emotional needs of those who are on the front line. So thank you for bringing that to my attention. And I will make sure that Commissioner Smith puts us directly in touch so that we can collaborate on that.
That would be wonderful. Thank you so much for all your advocacy and work on behalf of women. And then, of course, thinking about the substance use issue, especially in our young people. My children are actually around the same age as yours. And we see that, when they're experiencing things like anxiety or depression, they may not be able to seek care or know how to seek care, or parents may not be aware. And so instead they self-medicate potentially. And so then we end up with children and adolescents and young adults using substances for the first time, and then continuing to do so, and then becoming adults with substance use disorder. So prevention for us is really the goal here, in training pediatricians, family physicians, how to, and nurse practitioners and PAs, how to intervene earlier before this becomes a problem, before they start self-medicating, I think is another path to prevention. And VMAP, once again, can play a role there. So again, just wanted to put that before you, and thank you so much for all the time that you've spent with us today.
Thank you. I think it's a great point. I saw a statistic that 7% of Virginia's youth have a substance use disorder. I mean, think about that. I mean, these are young children. These are children under the age of 17. And so that is a very sobering statistic. And again, I think it is about being present and being observant, and also talking more openly about these issues. We're talking a lot in my office about some of the hardest issues, whether that's suicide, whether that's self-harm, whether that is the increase, like you say, in medication to deal with anxiety and some of these most debilitating mental health issues. And I, for one, am just feeling very, very emboldened by the conversations that I'm seeing happening across the Commonwealth to say, this is sadly normal, and we're going to come alongside you and love you and care for you, despite any sort of shame or discomfort that you feel. And it's something that I am particularly focused on in 2023, and I'm thrilled to have VMAP's partnership in it. And again, please let us know how we can show up and support you, because that is exactly what we are here to do. So thank you so much for all you do.
Great, and thank you. So now actually we'll turn the program over to our VMAP program director. Her name is Allie Singer-Wright, and Allie is the reason why VMAP works. We're all support crew for Allie, and so thank you so much, Allie, for all that you've done for us and continue to do for us. And I'm going to turn it over to you now so that you can give everyone an update on where we are.
Thanks so much, Sandy. Not quite true, but I really appreciate the compliment there. We'll jump right in. Sandy was able to highlight, Dr. Chung was able to highlight some of our key outcomes over the last couple of years, but I wanted to give you all a little more of a deeper dive into what we've been working on and what we've been doing. Here is our outline of our strategic plan. All of the work that we do, should, and does fall under one of our 6 primary goals. Those are scaling, demonstrating impact, quality assurance, enhancing brand awareness, and sustainability. This strategic plan is going to take VMAP through 2024, and then we will be working on a new one as an executive committee. So Dr. Chung outlined our 2 primary program components here. We have the VMAP line, and then we have our VMAP provider education. On the VMAP line, we've had 3,700 calls to date, as we talked about previously, but what have those calls looked like? 2,400 of them have been consultations with our VMAP child and adolescent psychiatrists. 368 have been consultations with our other VMAP licensed mental health professionals. These are those pediatric psychologists and social workers we have throughout the state. And then almost 1,900 have been care navigation cases. And so that is where a care navigator has been assigned to a case to support, to find those additional resources and referrals when needed. 1,400 of those, our care navigators, have worked both with the primary care provider and the family, and then 287, they've worked with the provider so that the provider can then in turn give the family the resources and referrals that we've recommended. When looking at our patients that providers are calling about, 55% have private insurance and 37% have Medicaid. This is a great example, a visual example to show our growth over the last couple of years. You can see where we started on the light purple line down there in August 2019. That was when our VMAP line first launched. It was very part-time, it had limited services, and we ate calls that very first month. Now through 2019, 2020, which is the dark blue line, 2021, which is the lighter blue line, and then 2022 to date is that dark purple line. We have grown that VMAP line to full-time, 40 hours a week. We've added more services on it, including care navigation, and we've launched it in every single region in our state so that any provider anywhere in the state has access to a local cohort of specialists to help them with their patients. And it goes up until last month there, and again, these are our monthly calls year over year, so you can see that the growth of our calls has aligned with the growth of our program. What are these calls looking like and who is calling? Let's take a look at our users for a moment. 75% of our callers to date have been pediatricians. 12% are nurse practitioners. So those might be a family nurse practitioner, a pediatric nurse practitioner, and 13% are some other type of provider. So that might be a PA, a family medicine physician, et cetera. 83% of our VMAP consultations have resulted in the provider continuing to support the patient in their practice. That's really important because we know we have a pediatric patient who's presented to a primary care provider with some type of mental health concern. And because of VMAP and the access that that provider has to VMAP, they've been able to actually support that patient there in the moment with that mental health concern. It's even more important because nearly a third of our calls, the provider says that there is a safety concern for their patient. And so we are actually able to help that provider address the safety concern in real time. Other top specific concerns we have coming through on our VMAP line calls are anxiety and worries, depressed or low mood, hyperactivity, impulsivity, and inattention. Switching to our other main program component, our provider education, we're going to talk a little bit more about what these look like in just a second, but they are all geared towards primary care providers, teaching them how to screen, diagnose, treat, and manage pediatric mental health conditions. We've held 18 REACH programs. These are our three kind of main education offerings for primary care providers. So we've had 18 REACH programs, we've had 10 Project ECHO cohorts, and we've completed 4 QI initiatives. Those QI initiatives are actually teaching providers to screen their patients for a variety of mental health concerns. Some of the screening tools that we've taught to date include screeners for mental health, anxiety, depression, social emotional health for early childhood, and social determinants of health and ACEs for early childhood as well. All of that education to date has totaled 22,000 hours of training for primary care providers across the state. If we break that out by our three main types of training, that's looked like 471 providers have completed the REACH training, 247 have completed the Project ECHO, and 113 have completed one of our QI initiatives. We're even having providers take multiple of our programs, which is really impressive given that they are very extensive and very comprehensive. We've had 58 take both our REACH and our ECHO, 35 take our REACH and our QI, 22 have taken a QI and an ECHO, and 8 have actually taken all three, and that adds up to 83 hours of training for each of them. Really shows their dedication to better serving their patients and being better able to manage the mental health of their pediatric patients. I'm going to now hand it over for a few minutes to our data analyst and evaluator, Matthew McKinney.
Thanks, Sally. Can you hear me okay?
Sure can.
Awesome. Okay. Hello, everyone. For those that I haven't met yet, my name is Matt McKinney, and I'm the data analyst evaluator for VMAP out of MSV, the Medical Society of Virginia. I'll start off and say that it's really great to be with you all today. I'm super excited to share some updates on where we are with the evaluation component of VMAP, and we'll be able to talk about that a little bit more. So with that being said, I'd like to spend the next few minutes going over the current status of all the evaluation activities as of today and what we're planning to achieve in the near future. Perfect, we're on the next. Okay. So before diving into the content of this slide, I want to quickly reference what was already covered by Dr. Chung, and that's the fact that VMAP has many different components within those two pillars that we saw earlier, so the education and the regional hub services. So each of these pillars and the elements within, they all collect specific information that informs us of a particular piece of VMAP. So with that in mind, our team has made significant progress this past year in being able to really adeptly collect, analyze, and disseminate findings that are really comprehensive of the entire program. So essentially pulling together separate pieces of information and data in hopes of telling a larger story that is VMAP. So to date, we've been able to achieve a few significant milestones that are really helping us reach that goal. First, we were able to publish our 2021 impact report, which contains all program data and implementation updates through the end of last year. And this will be something that will be completed annually and will really offer a holistic view of where VMAP stands consistently to our stakeholders. We've also been able to implement a new data management system in Salesforce that allows us to see in real time the raw data that we are collecting through the consult line and then eventually the trainings that we're doing. And in terms of instrumentation, we've been able to revamp the assessments used in VMAP's ECHO courses to really better understand new and relevant points of interest as they come up. And just a big shout out to Robin Cummings and Dr. Beth Davis in helping get that completed. And lastly, we've been able to collect feedback from our regional hub and education teams to really improve our internal processes of actually implementing VMAP moving forward. And to finish up the implementation year of 2022, we're currently administering a statewide provider survey, which will help us gain a new perspective on the true significant impact of VMAP in having an effect on providers. So all of this to say that the progress we've made in the past year is really feeding into our program's ability to, one, improve our internal processes when it comes to making data-driven decisions, and two, to accurately measure programmatic successes in a formalized and fluid manner. Next slide, please. So we've achieved quite a bit this year. Let's switch over and talk about what we're planning to achieve next year. So first, we'll plan to publish the 2022 VMAP impact report next spring. So this report will really look at all the VMAP data through this upcoming December 31st of this year and expand what was done in the previous iteration. So overall, this upcoming report will include a more detailed look at longitudinal changes in our data. It'll also include a more intentional look at new and exciting correlations between VMAP services and provider understanding around pediatric mental health. And lastly, it'll incorporate a quasi-experimental design framework using our statewide provider survey that is currently being administered. And this framework will help us really for the first time measure statistical significance of VMAP outcomes through the use of a treatment and a control group, with the criteria being if a provider has utilized our services before. We'll also be conducting a case study on VMAP's care navigation, which will be heavily based on quarterly focus groups we'll be conducting with providers who have used that service. So really getting that qualitative research into the mix is going to be great. And lastly, we'll also be conducting a more detailed exploratory study of birth to 5 patients who have benefited from VMAP. So again, we have a lot of good things coming up in the next year, and I know I'm certainly looking forward to it, and I hope you all are as well. And I think I'll go ahead and pass it on to my colleague, Stephanie Madrigal. Thank you.
Hi, good morning, everyone. It's really nice to be with you. My name is Stephanie Madrigal, and I am the VMAP Education Manager. And I'm looking forward to sharing a little bit more in depth about our education programs, as you've heard so much about today. And VMAP partners with the Virginia chapter of the American Academy of Pediatrics to offer 3 primary programs outlined here on the slide. One of our programs is REACH. REACH consists of a 3-day, 16-hour course and follows the intensive weekend with a case-based distance learning program. Participants join 12 bi-monthly 1-hour group conference calls, and that feature national primary care and child adolescent psychiatry experts, where they learn how to assess, diagnose, and treat pediatric mental health concerns. Currently, registration is open for 3 dates in spring 2023, and fall dates will be coming soon. VMAP also offers Project ECHO. Each Project ECHO cohort is an expert-led virtual training for small groups that meets once a month over the course of a year. Each session consists of didactic and case-based learning with a goal to improve access to mental health care for children. In 2023, we're offering 2 cohorts of a 101 course, as well as a cohort focused on early childhood and birth to 5. We're also launching a new cohort focused on youth and young adults. Brand new in 2023, VMAP is launching Early Childhood Systems of Care for Kids, which is supporting families with young children. This education approach takes an all teach, all learn approach to understanding when, how, and where to refer families for their youngest patients. Community subject matter experts will be paired with an interdisciplinary faculty team to provide practical and actionable infant and toddler connections for supportive pediatric primary care. Cohort members may participate in optional QI projects to help enhance screening and referral for social determinants of health. And all of our programs that we offer provide an opportunity to earn CME and or MOC credit. Enrollment for all of the programs here is open and available, and we encourage you to visit and register at www.vmap.org. In 2022, we were VMAP pleased to offer recognition and to train providers through the release of a digital badge. This digital badge recognizes the completion of one of VMAP's intensive education programs and is a symbol of both the individual and practice commitment to improving pediatric mental health. Each provider who received the badge completed a minimum of 20 hours of training. In total, 702 recognized providers received the badge in 2022, and we look forward to offering that for participants in 2023. This summer, VMAP launched the Virginia Mental Health Access Program Guide for promoting child and adolescent behavioral and mental health in primary care. The VMAP Guidebook is a compilation of evidence-based practices, up-to-date resources, and practical knowledge specifically geared towards pediatric and adolescent healthcare providers. Since its launch, there have been over 1,400 downloads. Portions of the guidebook, specifically many patient-facing resources, have been translated into 5 languages: Arabic, Chinese, Korean, Spanish, and Vietnamese, and are available on our website for download. It's been an exciting time for VMAP education, and we look forward to our offerings in 2023. Thank you.
Thanks so much, Stephanie. I'm going to take it back here and talk a little bit about our marketing strategy. We have a really awesome and impressive marketing and events person, Amy Waters, who cannot be on camera right now because she is making sure this event goes smoothly. If you can, Amy, say hi. We're very grateful for you. The important thing about marketing is VMAP is not very helpful to providers if they don't know it exists. And so this is a really key piece of our outreach and getting the word out there. Over the past year, we've launched on all major social media campaigns or social media platforms. That includes Instagram, Twitter, LinkedIn, Facebook. Please, just a quick plug, follow us. We are at VMAP VA, whether on your preferred platform or on all of them. It's a really great way to stay in touch with the program and to hear what's going on, especially if you're a provider. We have a lot of things coming up for next year as well on our marketing front. We have a strategic marketing plan that includes key performance indicators. We have new content being developed all the time, and we're working on a new blog that's going to launch next year as well. We mentioned our executive committee early on. Dr. Chung showed our key members of the executive committee here. We have a really big team in addition to that executive committee who is really making this program operate throughout the state. We have a core implementation team of 5 of us here at the Medical Society of Virginia Foundation. And then VMAP has a larger leadership team of 20. And then we actually have 55 staff members all over the state working at over 10 organizations doing the work of VMAP. And so whether they are facilitating a REACH training on a weekend, answering the VMAP line call, working with a provider, working with a family to get them into the care needed, these are the true boots on the ground. I know a lot of them are on the call here. I see a lot of their names in the attendee list. And I think I speak for our whole implementation team and executive committee when we say that you all are really the heart and soul of the program, making it happen every day. And we attribute all of this success to our incredible team throughout the state. We also have some committees that have some internal and external committee members. These help inform our program. One is for our education component. We have a provider education committee. We also have an equity committee. And then we have care navigation regional advisory boards. These are our regionally based committees where our care navigators are able to connect with community resources and partnerships so that we can make sure we're giving the best referrals to our patient families and to our providers. We have some really great initiatives that we've been working on, and I wanted to first start out with our early childhood initiative. This is a new program we've launched, and I'm going to hand it over to our early childhood physician lead, Dr. Bergen Nelson.
Hello, everybody. Thank you so much. It is such an honor to be with you today. My name is Bergen Nelson. I'm a primary care pediatrician at the Children's Hospital of Richmond at Virginia Commonwealth University. I'm also the early childhood champion for the state chapter of the AAP. And I recently joined the board of the Virginia Early Childhood Foundation. I'm passionate about early childhood and so excited and grateful to be able to be on the team helping with this 0 to 5 expansion. You can go to the next slide. So Sandy talked a lot about the need in terms of child and adolescent psychiatrists in Virginia. There is a shortage of child and adolescent psychiatrists in Virginia. And unfortunately, there is an even worse shortage of developmental and behavioral pediatricians in Virginia. As primary care providers, we often need these consultants, but unfortunately, because of the shortage, there are too long waits, which we'll see in the next slides. So there is this shortage of developmental behavioral pediatricians, but developmental and behavioral concerns are very common. 15% or more are affected by these developmental and behavioral concerns. It's one of the most common things we see in general pediatrics and in family physicians who see young children. We, as primary care providers, see children early and often in their lives. We see them from the time they're born and many times in the first few years before they enter school. And we're getting really good at screening. I think we're getting better and better because of concerted quality improvement efforts to do developmental screening and autism screening and behavioral health screening. But we need help. When we identify concerns, we need to know what the next steps are. And often that requires a more extensive evaluation than we're able to do in primary care, diagnoses and treatments that we can't provide. And so having these additional resources is so important for us. You can go to the next slide. In the early years of VMAP, that emerges a need that primary care providers need more resources in early childhood. Again, unfortunately, there's a long wait. We can do screening, but in terms of getting a diagnosis and treatment, specific autism treatments, the wait can be up to 12 to even 18 months. I was actually one of those 9 callers to VMAP this week on Tuesday. I called because of a 3-year-old I was seeing in my clinic that I'm concerned about has autism. Unfortunately, I made a referral 18 months ago. So it's been an 18-month wait. And in the meantime, all that time has been lost. He's kind of fallen through the cracks. And I am so grateful now to have VMAP as a resource. I called them and they are helping me to connect this family to needed services. So we also need training on how we can respond and things we can do in the office and as a primary care provider. And that training is really helpful. So that special combo of training and resources and care navigation and consultation that VMAP provides is being such a wonderful and important service for us. You can go to the next slide. We're so grateful for the expansion funds. And the special magic combo that VMAP will provide is this line to provide a hub that has specialized early childhood expertise. So every hub will have this option. We have developmental pediatricians that are coming on board, child and adolescent psychiatrists with early childhood expertise, and psychologists, child psychologists with early childhood expertise. Again, the early childhood approach is not always the same as it is for our older children and adolescents. And so having people with a specialized expertise is really important, and having care navigation that is very knowledgeable about this network of resources for early childhood in our community. And then the expansion of our education offerings. I was one of the early childhood participants in ECHO, and I'm very proud to have done that. And I'm very proud to now be leading this early childhood systems of care for kids, where primary care providers can learn more about those systems of care and resources that are available in the community. So thank you again. This is such important work. I'm so grateful to the support of our state leaders and this amazing VMAP team. And I will pass it along to our next. Here we go. Sorry, one more slide. So we have had already early childhood calls, 269 calls. It's been 8% of our VMAP call lines to date, and so sort of different particular concerns among those young children. So disruptive behavior, hyperactivity, and impulsivity. And again, in early childhood, that is treated differently than in school-age children and adolescents. And also concerns for autism spectrum disorders and developmental delays. So those are slightly different concerns than for our older children. And it's already starting to happen, but this expansion of the resources and of our education is really exciting. So again, we're going to be very excited to see what happens in the future as we continue this expansion. So now I'll turn it over to my colleague, Betsy Watts, to talk about the emergency department. Thank you.
Thank you. My name is Betsy Watts. I'm a pediatrician in Northern Virginia, and part of the expansion funds was for us to explore a relationship with the emergency physicians in the state. It's no surprise that we're also seeing the mental health crisis manifest in children and adolescents in our emergency department visits. We've, next slide. We have seen many of these statistics already in this presentation, but I wanted to highlight something you might not know, which is that there have been an increase, 24% increase in visits for children age 5 to 11. So it is our youngest kids that are also experiencing crisis that's ending up in the emergency department. Highlighting again, only 29% of young people in this age range have follow-up care within 7 days, and less than half receive follow-up care even within the first month. Overall, our utilization in the emergency department over the last couple of years has gone down, but mental health visits have increased. Next. ED physicians, like primary care physicians, family practice doctors, have limited access to psychiatrists, let alone those with expertise in children, especially in the youngest children. It's estimated that 70% of mental health patients can be discharged home safely, but there are barriers to doing so quickly or efficiently. So that many of the visits that we have in the emergency department are able to be sent home, but we can't necessarily do as much about those that are waiting for beds in mental hospital institutions. But what we need to streamline it is we need more support, more tools, and more education for the emergency department providers, as those are some of the barriers. So as you've heard, VMAP's currently supporting primary care doctors to help us avoid the emergency department altogether, working with the primary care for safety planning, suicidality assessment, level of care training, resource and referral navigation, so that we can take care of those patients in our own offices. So to explore with the emergency department, our first step has been to meet with emergency department physicians across the state and using multiple health systems to understand their resources and their challenges. Next slide. So based on our listening tours, we are exploring ways VMAP could support providers managing pediatric mental health in the emergency department. And from our initial feedback, we are planning a pilot in 2023, pilot education opportunities for emergency department providers on pediatric mental health based on topics of their choosing and based on topics of their need. We look forward to continuing to work with our emergency department colleagues on this important initiative in the next year. Thank you. I think I'll turn it back to Al.
Thanks, Dr. Watts. I really appreciate it. Now I'm going to have our REACH physician lead, Dr. Kreider. We have a couple awards to give out just briefly before we have some final thoughts on today. Dr. Kreider?
All right, thank you, Ali. My name is Amy Kreider, and I'm a general pediatrician working through Carilion Clinic in the Roanoke area. And my other roles are as an associate professor with Virginia Tech Carilion School of Medicine, and I am happy to co-chair a mental health committee for the Virginia AAP, in addition to the work that I get to do with REACH. As I was watching this webinar today, I really had a chance to reflect on the amount of growth and change in the VMAP program over the last year since I saw the Stakeholders webinar. And I really think about how proud I am and how grateful I am to be able to be involved in this program. In fact, I am working with the Virginia, with the VMAP consult line right now. I spoke to a psychiatrist earlier today, and I'm waiting on the care navigators to call me back at the end of the webinar, trying to keep an adolescent that I saw in my office yesterday afternoon out of the emergency room. He might end up there, but at least it won't be for lack of trying. But enough about me. I am honored to present our inaugural award for VMAP Reach faculty with the criteria of leadership, positivity, commitment, and caring to Dr. Jackie Cotton. Dr. Jackie Cotton is a former primary care pediatrician working for more than 20 years at Centera, where she retired from a leadership role. I met Jackie in 2019 at a Northern Virginia Reach faculty training program. And at that program, none of us quite knew what we were getting into. We had all been recruited there by Sandy Chung, and all had the same reaction, which was, oh my gosh, what is this beast of a thing that we are about to start teaching? It's very intimidating. So that you can imagine that there was a lot of consternation in the room. And Jackie, just like she is, was a calm in the storm. You know, she has a style of, it will all work out. We can make this happen. We just need to think about it. And since then, she's been an integral part of our faculty. She is the most active primary care physician on our VMAP follow-up reach calls. And she is an amazing leader. I'm learning a lot from her style, from her experience, and her generosity of spirit in sharing it. She artfully offers assistance and help from the wings with an amazing grace. So I cannot express how thankful we are to have Dr. Cotton as a part of our team. And I'd like you to join me in thanking Jackie.
Thank you so much, Dr. Kreider. I'm now going to hand it over to our Project ECHO manager to present the Project ECHO Faculty Awards. Robin?
Thank you, Allie, and we can certainly echo all those kind words about Dr. Cotton. She is also ECHO faculty and has just been an extraordinarily positive influence on our programming since she joined our faculty team. Dr. Beth Ellen Davis, who is our VMAP education chair, regrets she couldn't be with us today, but she does share our excitement for celebrating these terrific education champions. In keeping with our first annual Faculty Recognition Award recipient, Trish McDade, this year we have unanimously selected a faculty member who is an active and kind clinician who shares his passion for psychiatry and teaching in many ways. Dr. Jeet Annapareddy has been involved with VMAP in both clinical teleconsultation and education activities since its inception. Dr. Annapareddy is a child psychiatrist in Lynchburg at the Central Autism Center, and he has a unique combination of expertise in psychopharmacology and psychotherapy, as well as his learned medical knowledge. He assesses and treats many conditions such as autism spectrum disorder, behavior challenges with developmental delays, and severe trauma in childhood. Many of the conditions that he helps provide guidance on are highly complex and are difficult to diagnose. As a VMAP ECHO faculty, Dr. Annapareddy is always gracious and willing to step in for his colleagues with a moment's notice. He is flexible, humble, and most importantly, he readily and respectfully supports and connects with his primary care partners in VMAP. On behalf of the VMAP Education Work Group, it is our privilege to present this recognition to Dr. Annapareddy.
Thank you so much, Robin and Dr. Kreider. Those are two very important team members, and we're excited to recognize them. I'm going to now hand it back to Dr. Sandy Chung to wrap us up and talk about what's next for VMAP.
Thank you so much. And thank you for everyone who's sticking around for the last little bit. We are so pleased and so honored that you came today and that you spent some moments with us really celebrating all the great work that's happened in VMAP. I did want to talk a little bit about our next steps and, managing anything as big as the mental health crisis is a journey, and really beginning a journey, just you do that by taking one step and one step at a time and continuing to take steps as we move forward towards our goal. So I did want to talk a little bit, we've talked about it a few different ways and different times in this meeting, but just to close it out as far as what we're hoping to continue to work on expanding in VMAP. Next slide. One of the best ways we know that we can intervene and help children to develop optimal mental and emotional health is by providing supports to families as early as possible. The workforce shortage and poor payment system for this type of work has exacerbated our issue. And as Dr. Nelson mentioned, in 2022, we began the work of expanding VMAP to help primary care providers screen and diagnose conditions earlier in childhood from below age 5, truly. We did receive partial state funds for this work, but we are not able to expand it fully statewide unless we receive additional state funding. So that will be part of our advocacy work this general session. Next slide. And we know that the last several years has been traumatic for all of us. And trauma, as we know, affects the brain development of children, and prolonged stress results in continuous exposure to stressor hormones like cortisol, which can make permanent physiologic changes and genetic expression changes, which can actually change adult health outcomes. Next slide. But the great news is that with the science of resilience and attachment reinforce that adversity is not a destiny. We can intervene and we can make a difference. Next slide, yes. So actually, research has shown that the single most common factor for children who develop resilience and are successful in overcoming and adapting to trauma is at least the presence of at least one stable and committed relationship with a supportive parent, caregiver, or adult figure. That may be someone different in your life throughout your years, but just the presence of that adult, stable, nurturing relationship really develops what we call the affiliate response, and then helps to overcome the damage that experiencing trauma can create physiologically. Next slide. And so I mentioned this earlier when we were talking with First Lady Youngkin, that often that nurturing caregiver in a child's life can be the mother. And so in Virginia, unfortunately, our maternal mortality rate more than doubled between 2018 and 2020. And at least 1 in 5 people giving birth will struggle with anxiety or depression while pregnant or within a year after giving birth. And in fact, the most common complication of pregnancy and childbirth is perinatal mood and anxiety disorders, especially depression and anxiety. And on top of that, there's something going on in our country that's different than other countries, because we actually have the highest maternal mortality rate amongst industrialized nations in the world. So what can we do at VMAP? Well, we can certainly think about how do we assist OBGYNs and primary care providers who see these mothers, and pediatricians and family physicians, nurse practitioners, PAs. We see moms with their babies over and over and over again. And so are we able to screen and diagnose and then refer to treatment or help to manage the treatment if you're a prescriber for a mom? Possibly. The model works, and it actually has worked in other states. And so in order to do this, though, this would be a new area for VMAP and would require additional state funds to help this population. But I do believe strongly that the infrastructure that we set up, the people that we see every day in our practices, that pediatricians and family physicians who see children are actually very well suited for doing this. And in fact, we're doing it already. I can tell you that every day when we see newborns in our offices and infants, we're already often screening moms and dads for depression or anxiety. And if we find that a parent is experiencing or a caregiver is experiencing this, right now, there's not a whole lot we can do about it. Sometimes we just refer them back to their OBGYNs and then hope that they get care. this can be improved, and we can do this through VMAP. So that's just a little bit about what we're looking to do. Next slide. We did want to acknowledge our many, many partners. Probably not everybody is on the slide, but we would like to thank everyone who has been helping us. It takes a village for sure in this case, and we really, really thank you all for your time today. We thank you so much for your attention and your support and your advocacy. And for those of you who are taking care of kids every day, thank you for protecting the future generation of our country.
All right. That concludes our 2022 stakeholder meeting. Thank you again, everybody who was in attendance and all of our great speakers. We're very fortunate for all of these partnerships and support that we have. Happy Friday. We're ending right on time, and I hope everybody has a great weekend. Thanks again.
Thank you, everyone.